guys, for pterygium, let's look at the treatments. Basically, they are saying that surgical excision is the only satisfactory treatment for pterygium. Okay. So, what are the indications for surgical excision? Why will you try to remove the pterygium? Because of cosmetic disfigurement, right? Because of visual impairment, right? You have seen what the complications are, right? Astigmatism, right? Visual impairment. So, if there is progression, if there is a progressive pterygium, then what will happen? There can be pupillary area can be encroached, right? So, all these are problems. Then diplopia, you saw double vision, right? All these are the problems you have seen in the clinical features, right? So, because of all this, they will suggest us surgical excision. Now, how is surgical excision done? So, there are some techniques, okay? So, they do surgical excision in such a way that the recurrence should be less. So, these are some techniques they are saying. Surgical excision with free conjunctival limbal autograft. So, this is called as this. Surgical excision with free conjunctival limbal autograft, okay? Conjunctival limbal autograft, CLAU, okay? So, they will take this from the same eye or the other eye, and this is the preferred technique. Then here they are talking about another graft here, amniotic membrane graft, mitomycin C. So, this is another technique which you are saying which will be a good thing to reduce recurrence, because main problem here is recurrence. So, they are saying you should do it in these techniques to reduce the recurrence, okay. Surgical excision with amniotic membrane graft and mitomycin C, that is MMC, 0.02% application may be required. They are saying that it will be required of application of mitomycin, okay, amniotic membrane graft. Especially they are saying this will be required when you are dealing with recurrent pterygium or it is a large pterygium, okay. Then surgical excision with lamellar keratectomy and lamellar keratoplasty. So, this is another technique here they are telling, right. Surgical excision with lamellar keratectomy and lamellar keratoplasty. So, this may be required in deeply infiltrating recurrent recalcitrant pterygia, okay. Then there are some older methods not preferred now, like Mecranol's operation, etc. Those are all very old. And they used to use post-operative beta irradiations, etc. to avoid recurrence, but that is not used now, okay. So, surgical steps, excision steps are also given. Use topical anesthesia, right. First give topical anesthesia, clean the eye, drape the eye, expose it using the universal eye speculum, okay. Then lift the head of the pterygium. Lift the head of the pterygium and dissect off from the cornea, right? Dissect off the cornea very meticulously, okay. Then the main mass of pterygium is then separated from the sclera underneath. Then you separate this remaining part. What is remaining? Neck and the body and all that, right? So, main mass of the pterygium, you separate it from the sclera, okay. You separate the main mass of pterygium from the sclera underneath and the conjunctiva superficially, right? So, the sclera is underneath, right? So, you will separate this pterygium from the sclera underneath and the conjunctiva superficially. The pterygium tissue is then excised, taking care not to damage the underlying medial rectus muscle. So, you will excise this pterygium tissue, taking care so that you will not damage the medial rectus muscle. So far, so good, guys. So, let us say this is the eye and this is the pterygium growing here on the nasal side, let's say on the pterygium. So, the head is first lifted and dissected off the cornea. Then whatever remaining part is there, separated from the sclera underneath and the conjunctiva superficially. This pterygium tissue is excised so that you will not damage the medial rectus muscle. Then coming to the next step here, the hemostasis is achieved, right, and episcleral tissue exposed is cauterized thoroughly. Then conjunctival limbal autograft transplantation. This is the most, actually this is the latest and the most effective technique, okay, in the management of pterygium. So, what they will do, after you have excised the pterygium, right, there will be a defect. That defect will be covered with an autograft, okay. So, use the fibrin glue to stick the autograft in place. So, this will reduce the operating time as well as the discomfort associated with sutures. So, they are saying you have to use some fibrin glue. Okay. We will show you the photograph from the textbook Khurana. So head being removed here, then the body, right? Then some graft. Okay. So in this video, we have looked at pterygium treatment, surgical excision, right? That's all for now, guys. See you in the next video. Bye bye.